My name is Leanne Foster. I would like to welcome everyone to our webinar on the new CMS 855I Provider Enrollment Application. Thank you for joining us, and I hope everyone's doing well today. On the line with me is Tom Ryan, and he is part of our outreach and education team here at WPS-GHA, and will be assisting me with any technical issues and monitoring the chat for questions as they come up on this session. So before we get started today, I do have a few housekeeping items that I need to go through with you. So first, audio is available through your computer today. So if you run into any audio issues and you are able to listen through your phone, you just need to choose the audio video menu in the upper left-hand corner of your screen and switch that audio. There's a call me feature in there where you can enter a phone number and the session can call you back. Also, that information and the dial-in information, if you'd like to call in on your phone, has been placed in the chat for you. Today, there are materials available for today's session. First, there is a copy of the presentation. You're able to access that in a couple of ways, along with our timely topic document, which is just a document that is highlighting some other hot topics and items that we'd like you to be aware of. So again, if you don't have that in front of you and you'd like them, there's a couple of ways you can get that. First, there would have been a link included to to download those materials in the email reminder that you got when you registered for the session, and also the reminder that you got earlier today. When you click on that link, it is going to ask for a password, which is the word education, and links to that are being placed or have been placed in the chat for you today, so you can get that. Alternatively, you can also go out to our live events page. I'll ask Tom to also put that link in the chat. From there, you would simply locate the session today, which is the 855 enrollment application. You'll click on that link. It will prompt for that password, which again is the word education, and then you'll be able to download those documents. Hopefully we don't have any challenges today, but if you are having difficulties, please make note of the email address that's on your screen. It's wps.gha.education@wpsic.com. That is a mailbox that is being manned, so if you have any technical difficulties, you can send an email to that mailbox and someone will be able to assist you. If Tom is not already, I will ask Tom to put that in the chat. So we are recording this session today. We do have another session regarding the CMS 855 enrollment application updates later on this week on Thursday. After that session is complete, we will take a look at each of the sessions and select one of them to be posted on our YouTube channel as an encore. This will allow you to view the session again, or if you'd like to recommend to somebody you know, or you know someone who may benefit from looking at that video, it is out there for you. Questions today are going to be through the chat feature. You should have two choices in that chat feature, either to send to all panelists or all participants. I'm asking that you are sending those to all panelists. Again, Tom is monitoring that chat for questions, and all panelists just ensures that we're not going to miss any questions. Certainly don't hold on to your questions. You can put them in the chat at any point. I will check in with Tom throughout the presentation to answer those. If we happen to have more questions than time allows, we will create a follow-up document and we'll send those out to you, to the participants, so that everybody has that. So follow-up questions, if you have any questions after the session, you will be able to send those questions to our education mailbox. Again, that address is on the screen, and I'll ask Tom to put that in the chat. If you could put in the subject line the topic, which is also on your screen. It's the title of the session, which is New CMS 855I Application, the 8/15/2023 session. You can put that in there. We'll go ahead and get responses to you for those. Those questions, we will take follow-up questions for 10 days after this session, and I'll give you that date at the end. But again, you can send those in and we'll go ahead and get responses for you. And finally, this is our disclaimer. This is just making sure that you're aware that this session is for informational purposes only. The material that's presented today, it is accurate as of today, and as you know, Medicare changes often. So please make sure that you're reviewing official CMS communications, WPS-GHA communications, CMS and WPS websites for the most up-to-date CMS rules and regulations and any changes in the release date of this new form. It's also indicating that photographing, screenshotting, or recording of this education for profit making purposes is prohibited. As I stated before, this session is being recorded and will be posted to our YouTube channel as an encore. So again, for anyone who missed the session, or if you'd like to listen to it again or know someone who would benefit from the session, there's really no need to record it because we will make that available to you. And that brings me to the agenda for today. CMS, today's session is going to focus on the fact that CMS will be releasing a new version of the CMS 855I form in September of this year. As of today, the date that that form will be released to the CMS website is September 1st. We'll talk about those timelines, and I want to be very clear that the form is not public and on the website yet today. However, we will take a look at that form and talk through those changes today. So today's objective is to ensure you have an understanding of the changes being made to the CMS 855I and how they're going to impact the enrollment process and your submission of that form. During today's session, we will discuss, as I said, the timeline for implementation of the new form and the biggest change, which is a consolidation of the CMS 855I and CMS 855R form. This is by far the most significant change that's being made. We will focus on that first. There are some additional section changes, and that'll be what we'll wrap up with, is going through there. But largely, the huge change is that they are consolidating the CMS 855I and the CMS 855R. As I said, these updates go into effect on September 1st. The idea behind these changes are a reduction in provider burden, because it will streamline information that's requested. And these changes will also align the form with functionality being implemented as part of PACOS 2.0. So we're preparing for the future with this form. Again, streamlining what is needed to enroll providers that are reassigning benefits. I also want to stress that CMS will be allowing the use of both the current form and the new version. They will overlap for a little bit. So let's go ahead and start talking about how to identify the current form and the new version. And then I'm going to spend some time on the timeline. So first, if you are currently submitting applications electronically through PACOS, while these changes are going to impact you, they will be less visible. And that is because if you're submitting through PACOS, you're not going to have to worry about the version of the form. PACOS will be populated with the updates, or at least ask for the information. And I say that because some of the updates will not be in PACOS until PACOS 2.0, but all of the same information is being asked, and it will be formatted in the way the MACs need it when it comes in. So if you've submitted applications recently electronically, you're continuing to submit applications electronically, you will likely see no visible change. You may see the removal of a few questions, but for the most part, your world's going to stay the same for now. And it's not going to be a huge change for you. When PACOS 2.0 comes in, you will start seeing some of that change, because obviously the entire system is going to look a little bit different. So, okay, and I'm always going to recommend that you submit electronically as well. If you're not already, again, it does simplify this, okay? I am going to ask Tom to put a link to PACOS in the chat. That link is going to take you to a page that not only will give you access to, or allow you to access the PAYCO system, but also the MPES system and the identity and access system. So if you are not set up for PAYCOS, you would be able to get out there, set up a user ID and password, and if you wanted to submit electronically, you'd be able to start doing that. You'd be able to register as a PAYCOS user. You will also find on that page some tutorials that'll assist you with getting set up for that. So today's version, we'll move on to paper applications. So today's version of the CMS 855i has a version date. You're not going to notice differences with the paper applications on the cover. The cover is going to look identical. The key to identifying the new version of a paper form versus the old version of the paper form is going to be in the lower right-hand corner, which you can see I have a red circle on in the lower, left-hand corner. My apologies. You can see on the screen. So if you have a CMS 855i that is version 1218, that is, as of today, as of 8/15/2023, that is the most current version of the CMS 855i. Beginning in September 1st, the new version will be available, and the version date on that will be 5/23. Again, the new version of the form will be dated in the lower left-hand corner, 5/23, and I have some insets on the screen. The top box with the red frame, that is the old version of the form. The lower box with the green frame is the new version of the form. Next, I want to talk a little bit about the timeline before we start talking about the specific changes. So as I stated, September 1st is when we anticipate the new form to be available on CMS's website. It is not available today. That is because it has not been released by CMS as of yet. Again, we're about 2 weeks out from that release date, and we do not want providers to be sending in the applications prior to September 1. But starting on September 1st, the 5/23 version of the form will be made available, and MACs will begin accepting the new CMS 855i form. Between September 1st and October 30th, so this is that where we're going to overlap. We're going to run parallel with these forms. MACs will accept the new form, the 5/23 version of the form, but we will also accept the, as of today, current versions of the form, or what's going to be referred to as the old versions of the form, the 12/18 CMS 855i and the January 20 CMS 855r. We will accept all forms because I'm certain many, if not everyone on this call, has probably submitted applications recently. I can assure you those applications are not going to be returned to you. We have received them when they are valid, and we will continue to process those. If there's development out on those, we're not going to ask for a new version of the form. We will continue to process those because they were received when the form was valid, okay? Now, beginning November 1st of 2023, that changes a little bit. Applications that are submitted on or after November 1st of 2023 must be on the new version of the form. We will only accept the 5/23 version of the CMS 855i. We will no longer accept the 12/18 version of the CMS 855i. That will be returned, asking for completion of the 5/23 version of the CMS 855i. We will also no longer accept the 1/20 version of the CMS 855r. In fact, we will no longer accept CMS 855Rs. The 855i and the 855Rs, you'll see in a few minutes, are being combined. The CMS 855R for reassignments is being eliminated. Providers that are merely needing to add a reassignment will be doing so, filling out the appropriate sections of the 855i. It will not be the entire form. It will be similar to like a change. You'll fill out base information and the pieces that are changing, and we'll show you what that looks like. So before I dive into the changes, Tom, are there any questions?
Hey, Leanne, I do have just a couple that I think are worth asking. So when does PCOS 2.2, PCOS 2.0 come out?
So that is a fantastic question. Unfortunately, I don't have a fantastic answer. Right now, the go live it's in testing, and the go live is set for fall of this year, but we do not have a specific go live. Again, we're testing the system. There will be communication and there will be training ahead of that go live date once we know that we're going to be moving towards that. So I assure you that we are monitoring that closely. I am assisting with that testing, so there'll definitely be more information once we have that date solidified. But right now they're targeting fall of this year.
All right, perfect. Second question was regarding the new 855i paper applications. I did put in, Leanne has it on the slide, but I also throw it into the chat. So the release date's 9/1. That's when it's going to be available. It's also when your MACs are going to begin to accept it. Second part of that question is they're currently using the signature page on the 855i when they submit versus the electronic signature. Is that still going okay? Do we know if they're going to take the new signature page off of the new application?
At this point, are you talking, I'm going to ask one clarifying question. If you're talking with regards to electronic at this point, we believe that is still going to be something that can be done. And as far as signatures for the 855R, because it requires two, it requires the individual and an authorized or delegated official. Both signatures will still be required, but they are being incorporated into the 855I. But that paper signature will still be valid as
Perfect.
of today.
And then the other question that they had is, if they're actually using PCOS, do they have to be concerned with these changes that are coming up, or is everything good? Like they're not, it's going to reflect in PCOS eventually.
It is. It's going to reflect in PCOS eventually. You're absolutely correct. You don't have to be as worried about these changes. And I wouldn't say worried, but it's not going to be as impactful to you. It's going to be a little bit more invisible until the PCOS 2.0 implementation. Then the system will look different. However, you may see some of the additional questions, and so you will note there'll be smaller nuances that you'll notice, and you aren't going to have to worry because the MAC will have everything that they need because it was submitted through PCOS. The timelines are a little less impactful. If it was submitted through PCOS, it's automatically the right form. Great question.
All right. The other, a follow-up to the previous one is, can an uploaded signature page be used? Right now, they have the option for the electronic or the uploaded signature page.
Yep, at this time, that is something that can still be used. As we get closer to PCOS 2.0, that policy could change, but at this time, the discussions are that that's something that's still allowed.
That was our last question.
All right. So before I get into the changes, I do want to go through just to make sure everybody knows if you're doing a paper, we gave you the link to PCOS, so you're all set. But if you are doing paper forms, you know, sometimes people will print those out and have a supply. So I want to make sure everybody knows where those are if that's something you're going to continue to do. Again, I do encourage PCOS. However, if you go to the CMS website, there's a couple of ways you can do this. So if you go under the Medicare link on the website or section, and then you scroll down to the Provider Enrollment and Certification section. Under there, you're going to see the Medicare Provider Supplier Enrollment link. You will select that. And then on the left-hand side, you're going to see Enrollment Applications. This will give you, again, that link to PCOS, but also all of the forms. One thing I want to be clear about, this is going to give you the link to the most current form. So right now, this is the 1218 version of the form, okay? And it will update once the new form is available. For a period of time, it is possible they may not take the old form down until they're comfortable with the new form. They've not told us when they're taking the new form down. They've told us, the old form down. They've told us when the new form is going to be available. So I'm going to go back to CMS's homepage. And on the right side, you'll have to scroll down a bit, but there's a section for top 5 resources. And there are some links here for things that people commonly go into or frequently go into. One of them is always forms. So if you go into CMS forms, this is a listing of all of CMS's forms. So not just the enrollment forms, but if you were to search by 855 or 855I, it would show you the form. It would give you a link to the form. This is the same link that's on that page I just walked through, but it'll also give you the revision date. Right now, we have the 12/2018 version of the form. When this changes, it will be the 5/23. Okay, so that's how you can locate that form. Once you get into that form, and again, this is the old version, takes you to the page where you can download a PDF and functions the same. So the new form, like I said, is going to be available on that website. We talked a little bit about finding that. So we're going to talk about the changes. I want to drive home the biggest change being that the CMS 855I and the CMS 855R are being consolidated. Again, with PACOS, you're not really filling out an R section, you're filling out something that's asking about reassignments. That is in effect the CMS 855R. For paper, you will run into situations where you may need to fill out 2 forms to add a provider to a group that they are reassigning benefits to. You might need the 855I to establish the provider in the jurisdictional state or even with the Medicare program. Sometimes that 855I comes in to facilitate changes that need to happen in addition to requesting the new P10. A common one is correspondence and contact information may need to change with this new P10. So there's 2 applications involved. And then the paper 855R would be the form that would assign the P10. It's a lot of work. It's 2 forms to get 1 member. So CMS has taken a look at that and realized there's a better way to do this, and that's the consolidation. So the changes I want to highlight before I show you the form is, again, that 855I and that 855R have been consolidated. The CMS 855R on November 30th will completely go away. We'll accept it up until then, or excuse me, November 1st. We will accept it. But after that date, a CMS 855R will not exist. So the reassignment information that has historically been on the CMS 855R paper application is now going to be incorporated into Section 4F of the CMS 855I. And the signatures for the authorized and delegated official are going to be part of Section 15 of this new CMS 855I. So let's take a look at that so you have a visual. So this is the new form. And as I mentioned before, lower left-hand side, you'll see the dates. So this is the 5/23 version. Unfortunately, I can't distribute this. I can't provide a copy, but that will be available in the next couple of weeks on the CMS website. But I wanted you all to have a visual of it to actually see what the new form is going to look like. So I am in section 4F, which is the business information section, and it's the individual organization group receiving the reassigned benefits. So if you have a provider that is reassigning benefits and going to become a member of your group, meaning CMS will pay the group and the group will pay the provider for their services, this is the section you'll need to fill out in addition to all of the basic who am I, what's my social, date of birth, where did I go to school, licensure information. That base information that needs to be established for a new provider, you will also need to fill this out. So as you can see, the sections are going to look really similar. We're going to need to know who the individual practitioner is if they're reassigning to an individual. So if they're reassigning, say, to a sole proprietor with an unincorporated tax ID, Most of the time, though, it's going to be 4F question 2. This is going to be your group to which you're reassigning benefits. So here it's going to ask for organization name, tax ID, the group's Medicare number, and their NPI. Again, because they are reassigning benefits and it is the same information that's on that 855R. Question 3 is going to be that same primary location. So if you want to have a primary location for the provider directory that goes out on the Medicare website, you can add that. This is an optional section. It is not a required section, but that is also then incorporated into the new form, along with the secondary practice location. Okay. And that is the entire reassignment section. On the existing 855R, the next sections would be contact and signature. Contact's redundant. This is a CMS 855I, so you'll continue to put that information in section 13 as you always have. You just won't have to list it twice. Should give you greater control over the contact in case in today's world with 2 applications, there's multiple contacts on the apps. So it should give you greater control into that. And then the signatures will be in section 15, which I'll go to now. So here's section 15. Here is the practitioner, the provider signature. And then 15C is going to be the delegated or authorized official for the group that they're reassigning to, or if it's a sole proprietor, the individual they're reassigning to in 4F. So that's a pretty big change. So I'm going to check in with Tom. Did we have any questions in the chat?
We do. They want to know if you can confirm that if they're doing a reassignment for someone who's already enrolled, will they have to complete the entire form again, such as license, school information, all that different stuff? Or will they be able to just go to the reassignment area and complete that section?
Yep, so that's a fantastic question. So you're going to want to look at the reasons for submitting the application, okay? It's not going to ask for absolutely everything. It is going to indicate in what information is changing. So these reassignments are now really being submitted as a change. And one of the changes now is reassigning benefits of information, and it lists the sections that are needed. So it's sections 1, 2A, 3, 4F, which is obviously the reassignment, 12 if it's applying, 13, again, it's contact, so it's optional, and 15, which is the signature. So I'm going to show you section 2 here really quickly. 2A is really just this basic information. You start getting into licensure information in 2B. So you would fill out 2A because we need to know who the provider is, okay, if they're already established. We don't need to ask for their licensure information again. So you will not need to complete sections that are not necessary because your provider is established.
All right, Tony, if that doesn't answer your question, drop another chat down there for me so I can get that answered for you. But I do have another question in the meantime. Can you confirm if providers will be required to list their home address if they are using their home to deliver health services?
So that's a little out of scope for this webinar, but what I can tell you is that we have to have an address in the jurisdiction where the provider is practicing for telehealth. Depending on the setup, that might be the provider's home address, that might be an administrative address. So it really depends on the business setup.
Perfect. And then the response back from Tony is that there are a couple of fields such as the medical school piece of information, which would not typically be required on the 855R today, but would be required in the future based on what you're showing. Is there a reason for this?
They're leveraging a section. They're asking for that information. You're certainly not going to be asked to prove that information, and CMS does allow certain latitude for information that's already on file. So it's really just about them leveraging an existing section versus overcomplicating the form and having a section for identifying information for providers that are established versus new. Also helps us reconfirm the information that we have on file.
All Do you want me to keep going with questions?
Absolutely.
Is it okay to delete the pages of the sections that they're not using or not required, or do they need to send those in as well?
Oh, fantastic question. It is absolutely okay to remove those. You do not need to send instructional pages to us. For instance, it's a provider joining a group. Section 5.6, it's ownership. It doesn't apply to somebody joining a group because that information is on file with the group. Don't send it in. There's not a billing agency. Again, we're talking members today. So all of that information is going to be on the group. It's okay not to send that in. If you're doing paper, this is a fairly thick form. That can get expensive with postage. So you only need to send in the necessary sections for the task that you're trying to complete. And that's true of all of our forms. You just send in the sections that are required to execute the action you're requesting.
All right, so far I have one more, so if there's any more questions, make sure you get those into chat before we move on. But final question. So they're trying to do multiple reassignments. Do they need to have like an entire form for each one, or can they just add multiple section 4s so that whatever that section was, so maybe 4 copies if they're doing 4 reassignments?
Excellent question. It kind of depends on the tax ID that they're joining, and that's similar to today. So if you have a provider who's joining, let's just say 4 groups under the same tax ID, and they all have the same authorized or delegated official that will be signing the application, you would just do multiple reassignment sections with the group information, and it can happen on one form, and they can issue multiple PTANs. Where we run into the challenge is if they are joining groups with different tax IDs, then we would need multiple forms, and that is because they're going to have different signers. And that just makes sure that we are getting the right information. Makes it a little less confusing. It is a CMS directive, so and it's instructions on the form. So if they're multiple PTANs, all under the same tax ID, all have the same signer, you can do it on one form, just copy that reassignment section and complete it for each group. If they are different tax IDs, we will need multiple forms. And again, that has a lot to do with obviously the tax involved and the signers. It's a cleaner enrollment process that way. Great question.
So follow-up question, what if it's the same TIN, different MPI, same signer? Can you provide a copy of the reassignment?
It's the same tax ID, different MPI is not a problem. Same tax ID, different MPI, possibly a different PTAN, same signer, that's okay.
That's the last one that I show right now.
All right, well, let's continue on. So from here, I'm going to do largely screenshots of the application, but you will see the changes just to make it a little cleaner for everybody. But we can certainly go into the app if we need to. So I'm getting into the changes to the other sections of the form. You're going to see some things that have been deleted. For instance, I didn't highlight this, but section 2A, they've removed the gender question. It was always optional, but that has been removed. So they're removing things that no longer make sense. They've added a few questions, some of which are optional, just to get some additional information as Medicare evolves. It helps them make some of these decisions to have that information. And then they're also consolidating some things for clarification. So we'll start with section 2. So with section 2, 2B is where you'll see one of the most significant changes. We are now asking the question if this is a compact license, yes or no. Most often this happens with nursing specialties where states have reciprocal agreements where they will recognize other states' licensure, and they have the same requirements, so they don't necessarily have to get licensed in that state. So we're asking that question. It's a simple yes or no question. This is one of the questions you will likely not see in PACOS. It will not be implemented until PACOS 2.0. So don't panic if you don't see the question. It is an optional question at this point. The other thing that you're going to see in section 2 is going to be section 2C. They have moved it, but they have clarified why they're asking for the question that asks if you're accepting new patients. This is for the provider directory that is published, that beneficiaries have access to. We've asked this question for a long time. but the purpose was not necessarily clear to providers that were filling out the application. CMS is now making the effort to make sure that that is clear to providers. The other addition is going to be still in Section 2, you're going to see some changes for specialties. So they have added some specialties. So they have added, and you'll see my boxes are circling around the new specialties. We've added micrographic dermatology and adult congenital heart disease. Those are new specialties that are coming into play, so you'll have those for you. There's also an indicator for telemedicine. That is obviously more prevalent, and we're trying to make that easier to identify. The other thing that's been added is a question about whether or not the provider provides acupuncture services. And then also if they meet the laws and requirements in the state regarding such services. Now, I want to be clear that acupuncture is not being added to the application as a specialty, okay? You'd have to fall in line with the specialties that are on the application, but CMS is now starting to gather data about providers that are offering those or provide those services, and if they are licensed, okay? It's informational only at this time, and this is a question that applies to both physicians and non-physicians. One thing you'll notice, and it's the little insert on the lower right-hand corner, there are additional questions for non-physicians regarding the qualifications for documentation purposes. And they're asking about a master's or a doctoral level degree in acupuncture, okay? And if they have a current full active and unrestricted license to practice acupuncture. And if the answer to that is yes, they're wanting a copy of that license. So, and proof of the educational requirements. Again, I want to be clear, this is educational purposes only. Acupuncture has not been added as a specialty, but we are starting to inquire about it on the enrollment form. Okay. A couple of other things with Section 2, like I said, removals. I mentioned gender has been removed, and this is another really big change. Physician assistant sections have been removed on the new form. Currently, there's a section specific to PAs, and they will only fill out that section. They're not required to do an 855R. This is to get the form more in line with the changes in the Program Integrity Manual 100-8, sections 10.2.3.12, and I'm going to ask Tom to put links to that in the chat. The policy change, and as the manual states, physician assistants can now enroll individually. They do not have to reassign benefits. They can receive direct payment. They could be the owner and establish a group. Then they will reassign benefits. Physician assistants will fill out the new CMS 855I form in the exact same way physicians and other non-physicians would complete that form. And this removal, again, just aligns better with the change in the policy that happened a while back. So that's a pretty big change as well. Tom, are there any questions coming in the chat?
Yeah, there's a few of them out here. So I just want to make sure that it was chapter 10 in the Program Integrity Manual that you wanted me to put the link to? Okay.
Correct. And you said we had questions in the chat?
Yep, I do. Sorry. Now that I was putting the link in, so.
No worries.
All right, here we go. So can you confirm for the state of Kansas what providers are eligible for MCR, licensed marriage family therapy, LMLP? I'm not sure if we can confirm that because we do have to know a little bit about state licensure as well as that. So I don't know if you want to address that or not.
And it sounds like we're talking about the counselors. That is not fully implemented yet. That, unfortunately, is not something that we can discuss yet today. Some of that's still being worked out. I do have plans for webinars regarding those changes. Once we know more and we have an implementation, that will be a 2024 change. So unfortunately at this time, I can't provide that information regarding the addition of counselors, but stay tuned. There's definitely going education plan for that.
All right. And the next question is the gateway going to be available? And I'm going to assume this is the other contractor, and I don't know if it's Novitas or one of them has a provider enrollment gateway. So is that going to be available for WPS providers?
At this point, not that I am aware of, again, with the changes with PACOS 2.0, the gateway would be for submitting paper applications. I believe they're referring to submitting paper applications through our website. That is not something that is currently under development to my knowledge. Again, we're encouraging providers to enroll electronically through PACOS.
All right, so they're coming back to the P10, and so remember we're talking about, I apologize for that, we're talking about multiple reassignments. And so if they are doing it with separate MACs, so the P10s actually come from different MACs, can they do they have to do the same, multiple forms, or can they do one form and then send it off to multiple MACs?
Okay, so yeah, you need to separate them out. If you were to say send us a form that had Texas jurisdiction P10 on it, if that were the only P10 we developed for something inside our jurisdiction, if we knew the group existed, we would ignore the Texas. So I would not recommend doing that, but I can tell you, giving you a little glimpse into PACOS 2.0, that's something that when 2.0 is implemented, you'll be able to do that electronically. So that's something to look forward to. But at this time with the paper applications, you wouldn't be able to send it to one MAC and have them forwarded on to the other MAC if there's multiple on there. That consolidated application concept is not yet available. That will be something for PACOS 2.0. So you need separate applications.
Sure. Next question, will PAs need to individually enroll as of 11/1/23?
So they'll enroll just like any other group member. So they can still reassign. They don't have to enroll individually. The difference is there's no longer a difference in the application sections that they complete. They can enroll individually, but they do not have to. They can still be group members as they have been today. It's just they're handled like reassignments and no longer as a special case.
To those of you that are wondering, have had a couple questions come in. I just want to address this. When Leanne gets the other webinar ready for the counselors and all those different, please watch our e-news. We're going to put those out there. Also, I will put a link to the live events page. I did earlier, but I'll put it again. If you're not familiar with that, we will be posting those webinars on that page. It also then allows you to get the opportunity to download the material. So I'm really going to encourage you, take a look at the live events page, pay attention to the emails that come out on Wednesday. Those are super helpful to get all of that different information coming out. So we can't really go out and can't really go out and email individually to everyone, but we can do it that way.
And well, be sure that there's enough notice so that you all do see it, because that's definitely going to be certainly a hot topic for everybody. So thank you, Tom, for all of that.
And just we have another question coming in related to those counselors, and it says, will they be able to enroll as of 11/1, or will we still need to submit in December of 23 for the 1/1/24 participation? So when would we anticipate taking those applications? And I don't know if that's defined, but I'll leave you to answer that.
Absolutely. That is a very good question, completely understandable, but that has not been defined as of yet. They're still working all the policy questions out and making sure our systems are prepared to accept those applications. And at this time, they are not. So that is still being worked out. They have not given us, they've given us information that this will start in 2024. But they have not given us direction on when we can start accepting those applications as of yet. But that certainly, along the lines with what Tom was saying, that will be part of the webinars, but also that'll be in our e-news, not just our educational e-news, but even just our general GHA e-news, to make sure that that messaging is out. I'd also encourage keeping an eye out for CMS's Medicare Learning Network. There will be announcements there as well, so stay tuned. Some of that, again, is still in flux and being worked out, but it's definitely in the discussion. I just don't have a date for you.
And you can go, you're welcome to go ahead and move on. I'm going to go ahead and answer the last question so that they have the link for it.
Excellent, thank you. So the next section you're going to notice changes will be section 4. So we already talked about the changes in the reassignment section. So we're going back to section 4, but we're going back to section 4B. You're going to 4A and 4B. You're going to notice the questions are a little different. And what I'm showing you here on the left side is the current form, where the box is around a section that says you'll also need to complete a CMS 855R. That's being removed from the new form, and it's because you no longer utilize a CMS 855R. So you will notice that section will be shortened up a little bit. Here, I'll show you what it looks like on the new form. One moment. So here is where you will see the difference. There's 4 questions there now. There's only going to be, or there's 3 questions with that additional note. It's going to be shortened up, and it's just going to direct you to 4F instead of telling you to skip 213 and complete an 855R. So that's just cleaning that up a little bit to reflect the fact that we've consolidated the forms. The other thing you're going to notice is in section 4B, and this is not so much for your members. This is going to be more for your sole owners, your sole proprietor enrollments or applications. So they've added for when a practice location needs to be provided. They've added some additional location types. So they've just expanded upon it to make things a little bit more aligned, to align them more with what's actually occurring. And one of them is the home office for administrative telehealth use only. So that question that came in before, you're going to be able to identify that this is going to be for telehealth. Again, making some of that communication a little bit clearer and aligning with where we are as well as where PACOS 2.0 is going to take us. Section 6, again, we're not talking about providers that are reassigning. We're talking more about solo providers at this point, so we've changed a little bit. Section 6 is for any managing employees, because obviously if there are owners other than the enrolling provider, at that point we need the CMS 855B application. So this would be managing employees of a solo provider. They have added a relationship section. We want to know if they are W-2 or contracted. This again is going to align with PACOS 2.0. This is a question that already exists on the CMS 855B form. So they're just cleaning up the applications, aligning them in preparation for PACOS 2. And like I said, this is for sole owners and sole proprietors. And the last section that they made some changes to is going to be section 13. So 13 hasn't changed a lot, but they have added for the relationship to the enrolling provider, and they've provided some examples of what that affiliation is. This is just going to help Max better communicate with those contact people, and again, informational only, so we can kind of see the types of contacts that we have out there. So before I go to some reminders about the timeline and some resources for you, Tom, do we have any more questions in the chat?
We do. They're going back to section 4B. Is it not needed or helpful for those who reassign? They're not a sole provider or have a private practice. They're just wondering if it's required or if it'll be considered in the future 4B like it's today's 450, like in today's 855R to confirm correct reassignment based on locality.
It's really being used to confirm that correct reassignment. So I want to be sure, are you asking as far as the location information? I just want to make sure I understand the question, the type of location.
I'm waiting to see if they happen to respond because what I read is what.
Yeah. So, and while you're responding, I just want to be really clear. These are just identifying the type of location. It is going to be important in PACOS 2.0, partially for that locality information for sure, but also just to get a better idea of where providers are practicing.
So the response is yes, practice location information. You said it's not needed for a reassignment, but we use it all the time on today's 855R.
So on the 855, okay, I see where they're going. So 4B is never going to be required on your reassignments. This is going to be your solo providers. For someone who is reassigning, that's going to be in 4F. That is where you could put their location. One more. Pardon my scrolling. So when you get to section 4F, question 3, I think this is what you mean because these questions exist on the 855R, and we're asking for that. These addresses are about the provider directory. These addresses are not about the locality, and that is because if a provider is joining a group, that fee locality is determined by the group they're linking to. So if you have, I'm going to use Michigan because there's 2 localities. Basically, Detroit and everything around it is one locality. Some of the immediate areas, that same locality, and then the rest of Michigan is a different one. So we're looking at 01 and 99. If you have a provider that practices in both of those localities, there will be 2 PTANs assigned to that group, 1 for each locality. The county codes might be different, but the physician fee locality, we can only have 1 on a PTAN. So you're listing that PTAN information in section 4F, question 1, where it's asking about what group am I reassigning benefits to. And then the provider is going to be added to that group. And when the provider bills with their PTAN with that group, their payments will be based on that group's physician fee locality location. It's kind of like a parent-child relationship. That group is the parent, the members are the children, and they follow suit with the payment information that is programmed into that group. The locations that we're asking for do not come into play for the fee locality. They are really informational only. We'll put them in PACOS, and they will populate the provider directory, but they are not utilized in 4F for fee locality determination. I hope that helped. If not, please put it in the chat so I make sure I get your question.
Yeah, it looks like it did. She answered, yeah, 4F section, and then you answered her question, so we're good. Next question, actually the person lost audio. So I'm going to go ahead and skip that question. We may have to email that back.
Okay. All right. All right, so I just want to reiterate the timeline. So starting September 1st, the new form will be available. You'll see communications about it from CMS, the MLN. You'll see it in our e-news. We will start accepting the new form. And then again, that 523 is the paper version of the form. If you're submitting electronically, just keep submitting the way you are. They're not separate forms in PACOS today. It comes in as one, and the system does what the MAC needs it to do with it in order to comply with the current version of the form. From September 1st through October 30th of this year, we are going to accept the new version of the form, 523-855I, the old version of the CMS 855I, the 1218 version. We'll also accept the CMS 855, the 120 version. Okay, and that is through October 30th. Starting on November 1st, we are going to only accept, obviously, the electronic versions of the form and the 523 version of the CMS 855I. We will no longer accept the 1218 version of the CMS 855I or, as a whole, the CMS 855R. As of November 1st, the CMS 855R will no longer be a valid form. Tom, any questions coming in?
We do have one on the 855B, so would you like me to hold that and we can answer that individually offline on the email?
Yeah, I think we can do that.
Okay.
But we'll certainly get you an answer to that.
Let's go ahead and hold that then. Should the accept date of old forms be 10/31 of 23? So it says accept on 10/30. Should that be actually the 31st?
We posed that question. The directive that they've given us has the 10/30, but we believe it's also going to be the 10/31. I have to look at the calendar to see if that falls on a weekend, but either way, because electronically we get the right form. So we are waiting for a response of that, but right now, as of 1/1, we're no longer accepting the old forms.
And 10/1, just so you know, is a weekday. I know that because I'll be on vacation. So it is a weekday. So we'll wait more to hear about that.
Absolutely, and I'll send communication out in a follow-up because that was a question posed.
That's all we got.
All right. Well, I want to give you a few resources. These are resources that were put in the chat, but I will ask Tom to put them in the chat again. The first resource is PACOS. If you're not already submitting electronically, I encourage you to take a look at that link and leverage some of the tutorials and consider submitting electronically, particularly with the PACOS 2.0 implementation. It is going to make things a little bit smoother for you, and our dates for accepting the old form versus the new form are going to be less impactful to you because everything that comes through PACOS is accepted. I have also provided the GHA website. That is a site on our page that does have a lot of good information to supplement what the PACOS website has for electronic enrollment. And finally, the other item that I did provide is the IOM reference, the Internet Only Manual, the Program Integrity Manual, that refers to physician's assistants and the policy that has spurred the change to remove those physician's assistant specific sections from the application. And before I close, I just want to check again if we have any questions, Tom, that have come in.
Okay, so we do have the person that asked the question. I'm just trying to find her.
All right.
So Rhonda asks, in section 4B, if we indicate it's a SNF, does this imply that we're employed by the SNF? The example that she gave to go on was, we're doing outpatient services within the SNF by contract with the SNF, but are not employees of the SNF.
Yep, nope, you defined it perfectly. So it just lets us know that you are providing services in that facility. It does not by any means indicate that you are employed by the SNF. We just know that that's not a medical clinic, it's not a hospital. It happens a lot with general medicine providers, but it happens a lot with maybe physical therapists. It can happen with podiatrists. They're going in and providing some care to a beneficiary that is maybe domiciled in that SNF. We completely understand. We're just asking what type of medical facility that you're leveraging. It also lets us know you likely don't own that practice location. So it does not indicate that you are employed by that SNF. It just means that you're utilizing that SNF as one of your practice locations because you're seeing patients there.
That's all.
Okay. Well, I would like to thank you all for attending today. I'd also like to please invite you to take a few minutes to complete our survey now while it's fresh in your mind. I'd like you to tell us what you liked, what we could do better, and there's a lot going on, so please suggest any topics for further education. Your feedback is invaluable to ensuring that our education is timely and effective. And you have a couple of options. So depending on your preference, you can scan the QR code that you have on your screen, or you can use the link in the chat. I'm going to ask Tom to put that link in there. You will also be prompted with a warning message that it's taking you to an external site. That prompt is just letting you know it's not spam. It's letting you know it's going to take you to an external link that is that survey. Again, the Your feedback is super important to us. It lets us know if we are meeting your needs and we are providing education on the information that you want to know more about. So I encourage you to take a few minutes while everything's fresh in your mind. So if you're attending today and if you're needing continuing education credits for today, we will ask you to complete that survey, and also that you will receive an email. It will be from messenger@webex.com, so please check your junk and spam filters. Sometimes they go right there depending on the security that your business has on their email. I would encourage you to consider adding it to the safe sender list as well. But in that certificate at the bottom, you'll see a heading that is certificate, and it'll call out that it's a certificate of achievement. It will give you the date and the contact hours for you to submit to your accrediting body. So make sure you download that. And if you think of any additional questions, we have that question about the 855B. I'll take a look at that and make sure that you get a response to that. You have 10 days from today to submit them. So you can send them to our education mailbox and put today's date in the title of the webinar, which you'll see on your screen. And Tom, I'll ask you to put that in the chat just to make it easy for people. It's the new CMS 855I application, 815 of 23. That way they'll make sure those questions get directed to me. So on behalf of myself and Tom and the entire provider outreach and education team, I would like to thank you for your participation. We certainly look forward to your survey comments and hope you join us for future events. You may now disconnect.